All right, let's take a moment now for some important health news. Today in Checkup 13, we are taking a look at heart disease and why making a diagnosis of heart disease might be a little bit more complicated than you might think.
Come on, Hannah. Rocky Star! Come here, buddy.
It is so good to be back on the farm in Westfield.
He's a big guy. He's about 17 hands, so.
That's Rockstar, her horse.
He was a racehorse, if you can believe it.
Hannah, her golden retriever. And being with them brings Joan Grinkmeyer so much joy. And what a journey to get here.
You feeling kind of back to your normal self?
Yes.
Getting back into it?
Yes, and the cardio rehab's really helping.
Yeah?
I was so short of breath for so long.
Joan is now following up after a heart attack in June. She had a very persistent cough.
It was just gut-wrenching. It was enough that I almost thought I was going to be sick to my stomach. I was coughing so hard.
And then another pain appeared.
I could feel a tenseness in my chest, and I thought, this is different.
She was diagnosed with a large heart attack, and the fix was taking her urgently to the heart cath lab to open up that blockage with a stent procedure.
Joan is now in cardiac rehab, monitored exercise, and amazed at what symptoms she attributed to aging or illness that actually was her heart failing.
So afterwards, everything that hurt before, my back, my ankles, everything, I was like, nothing hurts. I've got circulation, I've got blood flow. So I'm just so grateful again that he asked the next question.
That dialogue with a doctor is key. Her heart scan was clear. There was the cough.
So cough is not something we commonly associate with a heart attack. But because she was having a heart attack, her heart muscle wasn't working as well as it should, and fluid was building up into her lungs, causing her to have this cough. So it's more of a downstream effect of her having this kind of heart stress and strain over a couple weeks' time.
Also to factor in, Joan is a recent widow, missing her high school sweetheart, Jerry. They would have celebrated 50 years of marriage this year. It's all part of the puzzle.
Absolutely. We know that patients who lose a family member, or even just going through a stressful illness themselves, can have what we call broken heart syndrome and can have heart complications around a time of a stressful event. It's definitely more common.
Joan says her experience is changing the way she listens to her body and making moments like this all the more meaningful. She shared her story with us because she wants to inspire you to make your health a priority. So part of what you can do is get a good accounting of your numbers and do that with your doctor. And a key number is your calcium score. That's what you get through a low-dose CT scan. It's called a heart scan. And we make it easy for you to do just that for Checkup 13 this month. The heart scan is for people who are 40 and older who haven't had a heart scan in the last 5 years. Now, to qualify, you must have at least one of these listed risk factors. It's available at a variety of Ascension and St. Vincent locations all around central Indiana. It is $49 for you, courtesy Checkup 13. So to sign up, all you have to do is call the hotline today. It's open until 7 o'clock. If you can't do it by then, as long as you go online and register at WTHR.com online on our website and do that by midnight tonight, you'll be good to go. Thanks for making your health a priority.